Welcome everyone to C-Suite. I have the distinct honor and privilege today of a brief interview with our magnificent fire chief, Greg Wormser. I just want to say, I told him that I wasn't going to gush too much, but I just want to thank Greg for his leadership during the pandemic and his continued leadership, as you'll hear later on in this interview. But he and his team, for the business community, all of those of you who had your folks vaccinated out at the mass vaccination center at Candler Station, Greg, as well as our Deputy City Manager, Reed Wotica, they were critical in that effort. Greg, along with Jonathan Wright and his whole staff, that I just can't say enough. I was privileged to be able to be part of that initiative, and I have to say it was one of the most rewarding things that I've ever done at the city. And it was also remarkable. And I know, Greg, this happens with your group all the time, but it was just unbelievable teamwork on the part of everybody involved in that effort. So I'll stop gushing now and allow you to introduce yourself. And thank you so much for being here, Greg.
Well, thanks for having me, Margette. You and your staff at Economic Development and Tourism are just, critical to what we do every day. And you all were a wonderful partner there at the Mass Vaccination Center. And so, thank you. But frankly, it took a lot of people to make that happen. It wasn't just me or Jonathan, but there were so many other people that were involved that made that happen. And frankly, we just felt like it was our duty, our responsibility, the reason why, we're supposed to be here at that particular moment in time. So we were thankful for the opportunity. I've been the fire chief now for 3 years, having started my career here back in 1995. So all the viewers out there can sort of then figure out about how old I am. But, I was a transplant here in Lynchburg long before people stayed in Lynchburg. People used to think I was crazy for staying here, but I knew when I started living here permanently in 1993, when I was going to then Lynchburg College, that this was the place for me. And, a lot of what I learned and experienced in the community and at, Lynchburg College is certainly what molded me into the person that I am today, and the reason that I stayed here. I never thought I'd be the fire chief. I always thought that, I would just continue serving the public, from a fire truck or from a supervisor's vehicle or from an ambulance somewhere. But I'm certainly thankful for the opportunity and glad to be a part of all the great work that happens here in the city.
That's awesome. And I will tell one more tale on Greg and probably Jonathan Wright too. They mass vaccinations to them were a family affair. So they brought everybody in their family, was a nurse or a scribe or something. And they spent many a weekend, all weekend long at the mass vaccination center. So the family that vaccinates together stays together. Is that right, Greg?
That's true. But I actually figured you were going to talk about my prowess at doing the wave across the entire room.
He is really good at that too, and he might even come and do it. If you have some events that you're trying to get your people fired up for after we get out of this pandemic, there's no better leader of the wave than Fire Chief Greg Wormser. So that's amazing. So, Greg, will you talk a little bit beyond your role as the fire chief? Unfortunately, Lynchburg is seeing COVID cases tick up. Can you just explain what other role you have taken on within the city in order to help all of us, all 1,200 or so employees at the city, as well as the schools, manage our way through this?
Yeah, so sort of by default, I've become sort of the COVID manager of the city. So I'm the go-to guy, and members of our team for all things related to COVID. So, we still continue to do vaccines throughout the city and have clinics. We do that in a variety of ways, which I'm sure we'll be talking about over the next few minutes. But really for the employees, Really, this is a two-pronged approach. Really, for the employees, it's the mitigation strategies that we can do internally, making sure that we adhere to policies and guidelines set forth by the CDC and the Department of Health. And then for the rest of our community, it's all of those things combined. So now we have an outreach coordinator who helps us and some other infrastructure that's in place to make sure that we're giving the best opportunity for not only our citizens, but our employees as well, to do everything we can to get vaccines into arms, which is what we have been talking about for so many months now.
Yeah, and I would just say to our viewing audience out there, which is the business community, that we had it in our last newsletter, but we encourage any of you in a workplace that if you have folks that need to be vaccinated, please call us or send an email or let us know, and we will do whatever we can to facilitate that. So that is ongoing. So I just want to put that plug in there again, that as Greg said, we're really interested in, getting as many people vaccinated so we can get back to business as soon as possible. So Greg, can you share an update on the local situation? I know I said that it's ticking upward, but give us a snapshot of vaccination rates and what the local situation is looking like, what you're seeing, symptoms to watch for that may, with the Delta variant, may be different than what the original COVID-19 symptoms were.
Yeah, absolutely. So, I appreciate the question, and just know that I could talk about it for hours. So I hope all your listeners are prepared for that. No, I'm just kidding. So, the Delta variant and the symptoms haven't changed. Unfortunately, like many symptoms we see in just about every illness that humans can have, it runs the gamut. Everything from headache to stuffy nose to I can't taste anything, I can't smell anything, nausea. So there's just a number of symptoms. What we encourage folks at this point to do is to think of it this way. If they're vaccinated and they have, do this self-check. If it's a time when you normally have allergies, then chances are it's probably allergies. If you're vaccinated and you have some symptoms, chances are it's not COVID. But regardless of what your symptoms may be, do that self-check, because you're really the best barometer about how you feel and what your situation may be. If you feel like you have COVID, or you feel like you have symptoms that are consistent with COVID, again, there's about 12 of them, everything from a headache to diarrhea, then we suggest that you go get tested. So having said that, you can get tested at most places. A rapid test or a test that you take at home isn't something that we recommend currently, because they're just not reliable, unfortunately. There's not enough data there that makes that reliable. So as a matter of fact, in most cases, LYH, or the Virginia Occupational Safety and Health Administration, much like OSHA, requires the PCR test to return to work. So in order to have a return to work status, you have to have a negative PCR test. As you point out, our cases continue to grow. We are impacted that both at the hospital, in the pre-hospital setting where we work, and at many local businesses, frankly, where I know that people are out sick. And that's what we want. We don't want people showing up to work when they're sick. We want them to stay home. That's the best way to prevent transmission of the disease. The only other best way is by good hand washing, mask wearing, social distancing, and be vaccinated. It's clear to us, the science is there, all the data is there, everything supports the fact that if you are vaccinated, you are incredibly less likely to be hospitalized if you have symptoms. Right now, at Centra, there are more than 115 people in the hospital with COVID. That's 14 more than there were Friday, and overwhelmingly, about 95 to 98% of them are unvaccinated. So it's very clear that COVID will strike, and it will strike much harder if you are not vaccinated. And that's why we encourage folks to be vaccinated. And to your point, we're still doing that. We're still doing that every day. We are happy to send folks to local businesses. We're happy to do it on the street corner. We want business to return to normal. We want life to return to normal. And so, we have all vaccines available all the time. And we have an outreach coordinator that can coordinate coming to local businesses, during lunch, during meetings, whatever it might be. As a matter of fact, I both know that, we had an email this morning from a local business owner who wants us to come to their business and have their folks vaccinated. So we're happy to continue to do that in the hopes that, again, we can get as many people vaccinated as possible. Right now, it's about 44% of the city of Lynchburg is vaccinated with at least one vaccine. That number continues to climb, which is nice. So as recently as about 2 weeks ago, that number was only about 38%. So we like to see the fact that number continues to climb. That tells us a lot about people wanting to get vaccinated, rethinking their choice, to be vaccinated, and we're certainly thankful that those folks do want to get vaccinated.
So, Greg, do you have any advice for businesses and individuals at this time? Definitely, if you're not vaccinated, to make sure that you get vaccinated as soon as possible. But if you are vaccinated, like what are the best practices you should be following? I know here at the city, we are all back in mask throughout city employees are all back in mask, so when you're in an indoor setting, are masks the way to go?
Yeah, I think if nothing else, when we're business leaders, when we're community leaders, when we're community-minded people, we're wearing our masks to model great behavior and to put ourselves in a position where we are doing our part to prevent the spread of the virus. It's clear, without question, that although not perfect, masks are certainly helpful at preventing that spread. So, we do encourage, people to wear masks. As you point out, in the city, we've gone back to masks for all employees. Many government agencies have done the same thing. And many businesses really never got away from that. I know that, when I went to my local grocery store, a few weeks back before things were getting worse, before they got better, I mean, even at that particular store, folks were still wearing a mask because that was their standard. And so, anytime that, we don't want to wear a mask. I don't want to wear a mask, although I don't have a face for radio. I'm sorry, a face for television. I have a face for radio. I don't want to wear a mask. It's just, it's cumbersome. It's uncomfortable. I get it. But I know that if I'm wearing a mask, it's helping prevent somebody else from getting sick, because even though I've been vaccinated, I certainly could still be a virus carrier and could, spread that to somebody else. So the strategies, I think, for businesses are, do what you can to provide masks for employees and patrons whenever possible. Make sure that your bathrooms are cleaned fairly regularly and there's soap in the soap dispensers. It's a great idea to provide hand sanitizer stations, either mounted to the walls in various places in the business or somewhere on the floor. Do what we do, hand out bottles. We have little bottles that we hand out to people that have our logo on them. Reminds them, of course, of who we are, but more importantly, it reminds them to use something to wash their hands a little more often. So those are the big, for us, those are the big key elements. Another thing that, business owners can remember, especially now, if the weather starts to turn a little bit cooler, is, open windows and provide some ventilation to the building. It's, studies have shown that the more ventilation you're providing to an area, the less likely it is that you're going to transmit the virus, or the virus is going to, be on a surface for that long.
And also, Greg, I think that the city, correct me if I'm wrong, is still standing by, and it may be VOSHA rules again, the Virginia Occupational Health and Safety rules, that we are still being very careful about the number of people that we get in a room somewhere. Still socially distancing, with the mask. And like you said, because we interface with the public, City Hall is open all the time, as probably are, other city facilities, is the social distancing piece of it. But to me, just correct me, that never seemed, that the OSHA rules never seemed to lift, the VOSHA rules.
Yeah, they didn't really lift. They only altered them really in one major aspect, and that was the mask wearing for a while. But again, some employers, kept on with the mask, which is certainly admirable. But they have now come back out and said, no, you really need to wear a mask everywhere, all the time, indoors. And there are many businesses in our community that would fall under those guidelines. And so, one of the things I often get asked by business owners, most recently, is, do I think we'll move back to a situation where we're going to limit the amount of people in a space at one time? And the answer to that is, I don't think so. There's been no evidence of that we're going to move that back that way, but that's a governor's order. That's something that comes from the governor and is not something that can be just arbitrarily taken on by local government without some other kind of order. So, while that's certainly possible that we could move back that way, in the future as we were previously, there's currently, I've seen no evidence or seen no reason that the governor would reinstitute some of those mandates.
Right. Okay. And I know we talked about it a little bit before, but I want to make sure that we are giving people proper direction. And that is, if an individual wants to get vaccinated or a business wants to get vaccinated, they are certainly welcome to come through our office. We will continue to promote the fact that you have a group that can get that done, but where should they go? I don't want you to be barraged with phone calls if that's not where the first stop should be.
Yeah, so the first stop should be a phone call to 455-5889. That's our COVID hotline. It is not always answered. In other words, you won't necessarily always get a live person, but what you will get is a live response. So in other words, somebody will either, if you leave your contact information, somebody will call you back. Our outreach coordinator will call you back and or email you. So that is the best way and the most appropriate way to reach us is through that number. Obviously, there are about, a half a dozen other ways to reach you or myself, as we've seen some of our, wonderful business leaders do in recent weeks. And we certainly welcome that. So they can email us and we can certainly put them in contact with our outreach coordinator. But really, the phone number is the best way. The 455-5889 is the best way to get that message to us. And then just know that, somebody absolutely, our outreach coordinator absolutely will call you back or email you with details and discuss, what we can offer and what we can do for you. And we've been all over the place, not just in the city of Lynchburg, but we've been doing this in several counties, including Amherst, Bedford, and Campbell, most specifically.
And so, Greg, and I really, really appreciate you taking the time to go over all of this. As the city of Lynchburg, you all held a press conference last week to let the public know about the numbers. I know Centra and the health department were all there. Is there anything else that you would share with the business community? I think that they have done an absolutely outstanding job of trying to get their folks vaccinated. You and I saw that when we offered it to them early on. They did whatever they could to get their folks vaccinated. Is there any other advice that you would give to the business community?
The number one advice is, if you feel like you've got just one person that wants to be vaccinated, get in contact with us. Because again, it's clear to us that the one thing that is very clear to us is the more people that are vaccinated, the less likely it is they're going to be sick or out of work. And so, we want to get vaccines into people's arms. I've been talking to people about sort of like smoke alarms. If I install 10 smoke alarms and only one saves a life, it's perfect. It did exactly what it was supposed to do. So if you have 10 employees and only one of them wants a vaccine, I want to put that vaccine in somebody's arm. So make sure that, what I want the business community to know is to make sure they've communicated that with their employees. Give them that option so that they know. Understand, I think business owners ought to understand also that, some employees may be reluctant to tell them whether or not they want to get a vaccine. And I think that, if that's the case, then I certainly encourage business owners to share the phone number with their employees, and the employees can call us directly to set something up. So, because it doesn't matter whether if you have 10 employees and only one person wants to be vaccinated, nobody else wants to be vaccinated, we'll vaccinate them someplace else. Like I said, we'll vaccinate them on a street corner. We'll meet them at dinner. Doesn't matter. We just want to get folks vaccinated. So for us, it's most important for business leaders to understand that that they may have employees that are reluctant to tell them. We see that in the city, that sometimes, early on, especially, our employees were reluctant to get the vaccine or even tell us that they wanted the vaccine. And now we're on a huge upward trend. Well over 50% of our city workforce is vaccinated, and that trend continues to grow. Those numbers continue to grow. And so that's probably the best advice I can give to the business community. If you want a vaccine, we've definitely got them available. We have all three.
Oh, that's awesome. Well, thank you again, Greg, for taking the time to talk about this incredibly important topic. And we hopefully the next time we interview you, we will all be celebrating the fact that Lynchburg has one of the highest vaccination rates in the state.
That would be great. And I know, Margette, I just know that, many people in our business community are struggling for any number of reasons right now. And so, if there are other things that we can do to assist you or them with their struggles, we're certainly happy to do so, because I know things are tough for so many people. We recognize that, and we're thankful for the businesses and their workforce and the work they do every day for our community.
Yes, we wouldn't be here if it wasn't for them. So I just want to, we will make sure, Greg, that we get that number publicized. It's 455-5899.
5889.
5889, 455-5889. So I think that's really great, because I do think that this has become something that people really do sometimes have a hard time sharing with an employer, whether they, like you said, whether they want to get vaccinated or they don't want to be vaccinated for whatever reason. I also know that you have been really great at being able to explain a lot of the things to our employees here, as well as to the general population, so that they have a comfort level with a vaccination or the different, the different vaccinations that are available, Johnson & Johnson, Pfizer, and Moderna. So thank you again for your time. And thank you so much for joining us on C-Suite. And thank you to the business community for all you're doing. Please let us know if we can be of any help. Again, that number is 455-5889. As Greg says, if you only have one employee, please have them call that number, because every one of you is important to us in the city of Lynchburg.